and welcome. Thank you so much for joining us for one of our weekly Fortune 500 focused webinars here. I'm Sam and I moderate these weekly presentations. In just a second, we're going to be joined by Michael Corgett. He's here today to give you some updates on the changes coming to Medicare in 2025. After his presentation, I'll jump back on with him very quickly and he will answer some Medicare related questions. I apologize in advance. We don't always get to answer every single question. We do like to respect your time. Please feel free to continue asking away in the Q&A box. It's completely anonymous and I will make sure another financial advisor can address those questions with you after the presentation through phone or email, depending. As a quick reminder, we are not affiliated nor endorsed whatsoever by any specific company. We are a completely independent group of financial advisors here, so please keep that in mind as you're listening along. And throughout the presentation, you're going to see some little links popping up on your screen. Now, those will be from me. They're going to guide you to our calendar where you can book with one of our financial advisors, as well as links to follow us on YouTube, follow us on LinkedIn, and a couple other resources we think you'll find of value. So please take advantage of those. And without further ado, let's jump right into the content with Michael Corgett.
Thanks, Sam. And thanks everyone for joining us today. As Sam mentioned, we're going to talk a little bit about Medicare, some of the changes, primarily what the costs have changed, but just to discuss some very basic ideas. And I'll interject some of my own personal thoughts since I work with a lot of retirees with many Fortune 500 companies. But let's go ahead and dive right in. All right. Medicare is basically Part A and Part B. Part A is your hospitalization coverage, nursing, hospice care, home health care. And as far as that coverage is concerned, you do not pay a premium at all. That is covered as part of Medicare. Part B, medical insurance, is basically what we call the doctor's insurance, preventive services, outpatient care, anything done outside of an inpatient admission to a hospital. And yes, that does require a premium. And that premium for 2025 has gone up to $185 a month for the basic Tier 1 monthly premium cost. It's a little bit more than $10 increase from last year's premium for Medicare Part B. What do you get for Medicare? Well, at age 65, number one, you get lower premiums. Medicare, again, is Part A and B, costs you $185 a month. You do get traditionally better benefits because the deductible in many cases is a lot more reasonable than it would be for your medical insurance plan through your current employer or any other coverage that you may have gone out to get. And it guarantees that 80% of all of your medical expenses are going to be covered. Again, private insurance might not cover 80%. It might be 70 or 60%. And there might be limitations on what doctors and hospitals that you could use. Listen, as far as a doctor or hospital is concerned, if they accept Medicare, you're covered. Your Medicare coverage will take care of it. Normal Medicare enrollment, that period starts about 3 months prior to your birthday month, and then it extends into 3 more months after your birthday month for open enrollment and then re-enrollment in any given year. What does Medicare guarantee? Well, it guarantees you access to excellent coverage. Both Part A, as I mentioned, hospital insurance, and Part B, medical insurance for those who qualify. And again, if you're eligible for Medicare and you're 65 years of age, traditional retirement, and you are paying your premium, you're going to be eligible for both coverages. It is a standardized benefit. Medicare ensures a consistent level of coverage across all programs, all doctors, all hospitals. So there's not going to be any surprises. You are protected against catastrophic costs. There is no limit as to how much Medicare will cover. There's no $1 million cap or $2 million cap. It is unlimited. Now, there is a cap on Part D, prescription drug coverage, which we won't talk too much about today, but Part D is separate from Medicare. It's the prescription drug program that was enacted about 20 years ago. So that would be a different discussion. And again, if you'd like to talk more about that, just reach out, schedule a meeting with myself or one of my colleagues, and we could talk more about it. And probably one of the best things about Medicare is you cannot be denied for any pre-existing health condition. You are covered. This is the government insurance that you were promised when you turned 65 years of age, and you cannot be denied coverage for any medical problem issue that you might have. So great benefit there. What does Medicare not cover? Okay, well, it only covers 80% of approved charges. So you're going to have to pay 20% of those charges, and that will be your responsibility unless you have a supplemental coverage program, which I'll talk about here in a moment. Long-term care does not cover custodial care in a nursing home, not covered by Medicare. There is some nursing home coverage that is covered by Medicare, but that is primarily rehabilitation coverages for after you've had a hospital stay. If you go straight from a hospital into some sort of facility for rehabilitation, Medicare will cover it at 3 different levels. First 20 days at 100%, and then the next 80 days there is a copayment per day. But again, if you have a supplemental insurance policy, those will more than likely be covered. In other words, what Medicare doesn't cover, your Medicare supplemental insurance plan will probably cover the gaps. So your out-of-pocket will be very limited. There's no out-of-pocket limit, as I mentioned earlier. Again, you're 20% on Part B. There is no cap there. So again, if you have a supplemental program, you're going to be protected as far as that's concerned. And then finally, non-essential services, things like cosmetic surgery, hearing aids, dental insurance, eyeglasses, many of these sorts of things are not covered under original Medicare. Let's talk about Medicare supplements or Medigap versus a Medicare Advantage plan, or what a lot of these companies like to call Part C. Part C, okay? Medigap, you keep Medicare. Now you've got a supplemental insurance plan to go along with your Medicare. You get to choose your own doctors and hospitals. Again, if a doctor or a hospital accepts Medicare, you're going to be covered. And almost every doctor and every hospital, for the most part, does accept Medicare. You are going to spend a little bit more money every month for a Medigap insurance policy, as this slide mentions, anywhere from about $90 a month for one of the lesser plans to upwards of $200, possibly more a month for one of the more comprehensive Medigap coverage programs. No referrals required. Some routine services may not be covered, as I mentioned, like vision or hearing. You're covered anywhere in the United States, and it's guaranteed renewable. Benefits will never change, and you will never be denied coverage for any pre-existing condition. On the flip side, Part C, Medicare Advantage, you forfeit your original Medicare. This new Advantage plan becomes your Medicare coverage. You have to work within their network of doctors and hospitals. So there is a restriction there. Your lower premiums for sure, your out-of-pocket expenses are typically less with an Advantage plan than a Medigap plan. You can get many Medicare Advantage plans for a $0 monthly premium, a $0 monthly premium, okay? Or maybe a little bit more than that, but it just depends on how much coverage that you're electing. You might need referrals to specialists. That's a key thing to consider. It may include additional benefits, including possibly dental insurance, hearing aids, eyeglasses or eye exams, these sorts of things, gym memberships, even potentially, I've heard more about debit cards that are included that might help you to pay for some of your groceries. Emergency services outside of your service network are not going to be covered. So there are limitations to Medicare Advantage plans that you don't have to worry about with a supplemental insurance plan. And bottom line, the real key here is that supplemental or Medigap plans are true insurance policies. They're in addition to Medicare, and they do have an out-of-pocket monthly cost, including I'm sorry, on top of the Part B premium. So you could spend upwards of $350 to $400 a month for your Part B and your Medigap insurance plans. Whereas with an Advantage plan, you may only just pay your Medicare premium, but that Medicare premium is going to go to the insurance company that you're going to choose. I could talk an awful lot more about this. Again, schedule a meeting with myself or one of my colleagues, and we could get more into the weeds about this. This is a perfect time of year because this is a time where many Medicare recipients are making decisions as to whether to stay with their current carrier or look at something different, or consider going from a supplemental plan to an Advantage plan. Here, high income earners, and this includes income that is passive income. If you earn more than $212,000 in adjusted gross income as a joint couple, or $106,000 individually, you will be charged what's called an IRMA additional premium, income related monthly adjustment amount. Just remember IRMA. There is a chart, a table that you could get off the Medicare website, and I'm going to show you that here in a moment. This adjustment will be tacked on to your original Part B and Part D, your prescription drug plan premiums. Let's get into an example of a couple. We've got Bob, who's 65, and he's eligible for Medicare. And then we've got Jane, who's only 62 and still needs traditional medical coverage. Let's just say Bob retired from company XYZ, and he signed up for Medicare. He doesn't have any sort of retirement Medicare or medical insurance program through his previous employer. So he's going to have to go out to the healthcare exchange and look for coverage for Jane. So the premiums here are somewhat a good example of what they would be. No IRMA benefits. Okay, so Part A, no premium. Part B, $185 a month for 2025. In this case, Bob's going to pay $127 a month for a Medigap or Medicare supplemental plan and a prescription. He's got an inexpensive prescription drug card program. So Bob's going to pay $312 a month, which is not bad for, pretty good coverage. But Jane, on the other hand, she's going to have to go to the healthcare exchange and get a silver, what we call a mid-level program, a PPO plan with Blue Cross and Blue Shield. And unfortunately, Jane is going to have to spend $1,200 a month for that same coverage. Total $1,512 a month. It is a lot of money, but this is something that happens quite often when we work with people. A lot of times one spouse is younger than the other one is, and you have to keep that in mind. Your employer-sponsored plan usually allows you to cover your spouse for an additional premium, but nothing like the example that is shown here. So again, this is a one-on-one and individual discussion for you and your household. Just something we wanted to give you and I something to consider if you were thinking about retiring, but your spouse is younger. And I mentioned IRMA. Here are the tables where the premium for Part B under 212 for a joint couple, 106,000 for an individual is $185 a month. And as you could see, as the income levels go up, the Part B premium goes up as well. And it goes up pretty significantly. Excuse me. In this example, from 185 to $259 a month, plus your prescription drug program has a surcharge as well, so on and so forth. One of the things that you've got to keep in mind as far as IRMA is concerned is Medicare is going to look back up to 2 years prior to you getting on Medicare. So if you had a real good job and you had a great salary with a good bonus, you may actually get stuck paying these additional IRMA premiums for at least a year into your first year of Medicare. Something to keep in mind. Again, this table is available on the Medicare website. If you want to talk more about it, please just let us know. How much does health insurance cost per month across the United States? Essentially, the darkest blue states are the ones that are the most expensive. For the most part, better than half the country averages between $600 and $800 a month. In some cases, some of that lighter blue is going to be 400 to 600. Very few is going to be the $200 to $400 a month. But an example that's listed here, someone from West Virginia may pay $955 a month, one of the most expensive states for health insurance in the country, versus someone in Maryland, the same coverage, same plan, less than half, $412 a month. Something to consider. And premiums all over the country. Here's some better examples. A 40-year-old with a silver plan might average about $627 a month, a 7% increase over last year. But in Vermont, $1,157, New York, $1,038, and so on. So again, some states, primarily East Coast and West Coast states, are going to be more expensive than the average state, or I like to say the flyover states. The Midwest, as an example, I'm based here in Missouri. So again, these are just some things to keep in mind where you live. This may not surprise you because you've already gone out and looked for coverage and you happen to live in New York or Vermont or California or the state of Washington, where they typically have higher premiums for medical coverage. The Part A costs are increasing approximately 2.7% in this year, 2025. A little bit, the deductibles, inpatient hospital deductible has gone up a little bit. Daily inpatient co-insurance from the 61st day till the 90th day has gone up a little bit, and so on. Co-insurance has gone up as well. These are the gaps in coverage that you have with Medicare. And these are the reasons why you really want to strongly consider getting a Medicare supplemental insurance policy. That additional premium can definitely far outweigh the potential additional costs that you might have if you have a serious illness in retirement. I strongly recommend that you consider some kind of supplemental insurance coverage. And that's what I tell all my clients. And then just something else to consider. I'm going to switch gears just here a little bit, but the idea is of working with an advisor like myself. We are in the investments business here at the Retirement Group. We manage retirement assets for our clients. I personally have been in the business for more than 35 years and helped hundreds, if not thousands, of individuals to retire comfortably. Well, asset-based fiduciary responsibility type of investment programs, and we are a fiduciary, typically average around 1%. But what I want to show you here is that we really consider that we do add a lot of value that you may not even think about. Suitable asset allocation, the cost efficiencies of working with an advisor, rebalancing, behavioral coaching. I thought that was very unique. We spend a lot of time talking with our clients, helping them with all sorts of situations, not just investment management, but estate planning, tax planning, insurance planning, just to name a few. I know a great deal about a lot of things, and I know I can be helpful in a lot of areas, and all my colleagues can do the same thing. This chart really is just to give people an idea of the value that we really add, and that value broken down in percentage terms. We don't charge 3%, but we believe that the value that we add does add up to 3% and possibly more. So again, I've said a lot about Medicare today. I sort of ran through it pretty quickly, but wanted to touch on the highlights. If you consider working with a retirement group or a team of advisors with a great deal of experience, we've got offices nationwide. We've got a great knowledge of many of your 401ks and pension plans. Again, as Sam mentioned, we work with a lot of Fortune 500 companies. We consider ourselves niche marketing into many of those companies. So we really do understand your benefits program. And something that I haven't mentioned yet, complementary cash flow analysis. Please take advantage of this. We use a great software planning tool called eMoney, and we could put together a very comprehensive retirement plan analysis for you, just to let you know where you stand today, if you're going to retire a month from now, a year from now, or 5 years from now. One thing I want to mention is the sooner that you start planning, the better off you're going to be. So take advantage of this complimentary service. Finally, if you'd like to schedule a meeting with myself or one of my colleagues, scan this QR code here on the left. You can scan the one on the right and follow us on LinkedIn. I strongly recommend that you do that because we have a lot of information on our LinkedIn page, including our future webinar schedules. We put out all sorts of information on all sorts of different subjects. You can also follow me on LinkedIn, Michael John Corgett, on LinkedIn as well. You could give us a call at the number listed here or send us an email at info@theretirementgroup.com. So with all that, I'm going to ask Sam to come back and join us and see if we got any questions.
Thank you, Michael. Yes, that's a great presentation. There are some good changes coming to Medicare. So thank you for making everyone aware of those. We'll just answer a couple questions so we can try to keep it short here. This first one, are there strategies to manage my adjusted gross income to minimize surcharges on Part D and Part B and Part D?
Yeah, there is. Honestly, the hardest part is at the beginning when you finally turn 65. But once you get into Medicare and obviously get into retirement beyond age 65, it does get a little bit easier. It's kind of like an offshoot of required minimum distribution planning. Well, do I want to take money now, or do I want to wait until I'm 72, 73, or 75 and have to take these massive RMDs and pay tons of income taxes on them? The same thing does hold true to try and control your IRMA expenses. If you have any control, it's probably going to be on your investment income. If you have a pension, your pension's not going to change. It's going to be a monthly benefit, more than likely not going to increase with the cost of living. Social Security, another thing we can all hopefully count on in the future. There will be some cost of living built into that, but where you can control the income is from your own investments, your own part-time work. We do sort of juggle these sorts of things. I'd love to talk to this person specifically, or anybody who feels they might be in this situation, and give you a little bit better idea. And then finally, the cash flow analysis can help you with this as well. So I hope that helps.
All righty, thank you. Last one. Should I enroll in a Medicare Advantage plan with a lower maximum out-of-pocket limit, or stick with original Medicare and a Medigap plan?
That's a great question too, and everyone is different. I personally believe that people that have any sort of health conditions going into retirement at 65 and beyond, okay? And again, I stress, if you've got some pre-existing health conditions, you will want to consider starting with a supplemental plan, because again, there's no pre-existing conditions. For Medicare, there is no pre-existing conditions for a Medicare supplemental plan in the beginning when you turn 65, okay? Medicare Advantage plans can be great plans. Their out-of-pockets are typically less. You may never pay hardly anything for a doctor's visit or a hospital stay, or a limited co-payment for prescription drug cards. People that are healthy typically do have a great benefit more with an Advantage plan. The biggest downside is that if you do choose to go to an Advantage plan, and then if at some point in your life you want to go back to a Medigap, a supplemental plan, you have to prove insurability, and that could be very difficult. That premium could be rated. It could be rated so high that it's not affordable. I consider this one of those one-on-one discussions. I am sharing many of my own personal opinions, but this is, personal thoughts that I've gleaned for years of working with retirees. So just some, hopefully that helped a little bit in answering the question. I interjected a little bit of my own personal thoughts in there as well, but I think it can make sense. Either one can make sense.
As a follow-up, just my personal question here, Michael, what would be a reason in your experience that someone would go from a Medicare Advantage plan to a, wanting to switch back to
You
original?
know, that's a good question, Sam. And the way I'll answer it is this. Advantage plans have grown to be very popular. You
Mhm.
see them advertised all the time on television, especially this time of year, which is the traditional Medicare enrollment, Medicare supplement or Advantage enrollment periods. Um, Many of these Medicare Advantage plans are obviously they're underwritten by Anthem, Blue Cross and Blue Shield, or Humana, Cigna, possibly, and even United Healthcare. Okay. Um, a lot of doctors and a lot of hospital systems are beginning to drop
Oh, okay.
these insurance companies because they're sick and tired of not getting paid or not getting paid on time or having all their claims denied after the fact by the insurance company. In other words, these advantage plans are getting stingy.
Mm,
And that could be a really good reason.
okay.
Here in St. Louis, I'll give you a perfect example. Anthem, Blue Cross and Blue Shield, their Medicare Advantage plan, both pre 65 and post 65, but Advantage is post 65. The Mercy healthcare system of hospitals and doctors dropped Anthem, Blue Cross and Blue Shield here in the St. Louis area because they were sick and tired of being sick and tired of not getting paid.
Right.
It was big news here in the St. Louis area, and this is going on all over the country. That is a reason why you got to be careful. You got to be careful.
Alrighty. Well, yeah, that's a great thing to be aware of. I wasn't thinking like that, but alrighty, Michael, go ahead and put up your QR code really quickly again so they can just screenshot that if you're on a phone, or there's also going to be the links popping up on your screen if you want to click on that. So you can book an appointment and speak to Michael. If you have any follow-up questions, please feel free to book an appointment. You can speak with him directly, and he's obviously very knowledgeable. He can answer those questions for you. Alrighty, Michael, thank you so much. We appreciate all of your time today. And we want to thank everyone for joining us today. We hope to see you on another webinar again very soon. Thank you. Bye, Michael.
Have a great day.
Bye.